The newsday continues here on One News Now. I'm Riza Diaz. While some local officials are under fire for jumping the inoculation line, the Senate said they will follow the priority list. But with COVID-19 infections on the rise in the chamber, they are also eyeing to get their own vaccine supply. Faith Del Mundo gives us the details live from Quezon City. Faith?
Yes, Riza, because of the increasing number of Senate personnel who are positive of COVID-19, the Senate plans to procure 5,000 doses of the COVID-19 vaccine. In the Laging Handa briefing today, Senate President Vicente Tito Soto III said the Senate is eyeing to get Russia's Sputnik V doses by April. Soto noted that there are now 24 Senate staff who tested positive of the virus. Majority Leader Senator Juan Miguel Zubiri said he suggested that the Russian vaccine, but they will remain open for other available brands. He said they are in touch with Malacanang and are hoping to be allowed to procure their own vaccine supply. The allotment will be administered to more than 2,000 Senate staff members. While there is no clear timeline yet on the Senate's inoculation plans, they hope to be vaccinated by the time session starts in May. Soto stressed that the health of all Senate personnel is important, but they will not be cutting in the vaccination line, adding that the health workers should still be prioritized for the COVID-19 jobs. Risa, the Senate has been on lockdown since March 17 due to the recorded COVID-19 cases and will remain off limits until April 12. The House of Representatives was also placed under lockdown since last week due to COVID-19 infections. Riza?
Thank you, Faith. That was Faith Del Mundo reporting live from Quezon City. The Commission on Higher Education has given the green light to 24 schools to conduct face-to-face classes. This is expected to start on the second semester of the academic year 2020 to 2021. Let's talk more about this with CHED Chairman Prospero de Vera III, who's joining us live. Sir, good afternoon. Chairman de Vera? Chairman de Vera, magandang hapon po.
Ba't nakamute? Why am I on mute?
Sir, we can actually hear you. Can you hear me, sir? This is
You can hear me? Okay. Okay, I'm here.
Sir, first off, what are the criteria for allowing a school to facilitate learning on a limited face-to-face setup? Can you enlighten us, please?
Well, first, the approval of the President in January limited it only to certain degree programs, medicine and allied health sciences, and this includes nursing, midwifery, medtech, public health, and others, only for students in their third and fourth year, and only for subjects that cannot be delivered virtually. Meaning these are subjects where you need internship, for example, clinical internship for medical and nursing students, use of laboratories, etc. So that's the first criteria. It's not for everyone. It's limited only to certain individuals, 20 years and above, third year and fourth year students, and limited to certain degree programs. Second, the reason why this was allowed is because these are degree programs where you need to produce the critical manpower needed for our COVID-19 pandemic, and these are health professionals. So they're the first ones that we need to move back because we need to produce doctors, nurses, and other health professionals in the coming years. The schools have to apply, so it's not automatic. They have to be applied. They have to be inspected by the commission and the local governments, and they must comply with the guidelines issued by CHED and the Department of Health. So that's the approval that was done in January. So we have been inspecting the universities that applied since January, and 24 of them have been approved, starting, some of them starting as early as January, some of them were approved only last week.
Mm-hmm. Sir, can you quickly run to us the guidelines for students and faculty members once they return to this setup?
Well, first, the school must be adequately retrofitted. That means the facilities, the classrooms, the laboratories, the chairs must be separated 1.5 meters apart. The ingress and egress, in and out, must be clearly delineated. The airflow is controlled. The movement of students and personnel going up from one floor to the other is controlled. The library is retrofitted, the canteen is retrofitted, and all other facilities are retrofitted in the university so that proper health protocols are observed in all these universities, including signages and instructions on how many students can go inside the room, the directions of movement of students. These are all covered by the guidelines that were issued. They must also consult and coordinate with the local governments, essentially because conditions on the ground are different as you move across the different political jurisdictions. And they have to work with the local governments, particularly if there is infection, so that the students or the faculty can be brought to the nearest facility. And the CHED will continue to monitor it. And if there is an infection, we close down the school momentarily so that it can be disinfected and we can assure the health of the students.
Sir, in the event that a student or teacher refuses to participate in this said in-person learning, what will happen to them?
It is not mandatory. There is a requirement in the guidelines for the schools to consult with parents and students. And if the students don't want to go to school, they must be provided alternative systems to learn. So it is not required for everyone. There is a requirement for consultation.
Sir, the country's been breaking records as to the number of cases daily. There's no stopping from implementing this setup in spite of the surge in numbers?
No, the universities actually stopped it even before the surge started. Our universities and local governments are very responsive to the situation. So all the universities in the National Capital Region and the outlying areas have pulled out their clinical interns from hospitals as early as 3 weeks ago and have stopped limited face-to-face even before the government issued its advisory on restricting movement. You cannot, it is not logical to stop it all over the country because the situation on the ground is different in different areas of the country. So we rely on the universities and the local governments and the commission to work together that if there is a surge in infection, then automatically the guidelines provide that the schools should stop the limited face-to-face until the pandemic is under control.
Well,
So there is no problem as far as NCR is concerned because the schools have already stopped it even before the surge happened. When there was the start of the increase, even before the IATF announcement came out, they had already pulled out their students from clinical internship in hospitals.
Thank you, sir, for your time and for all those information. That's CHED Chairman Prospero de Vera III. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. As Holy Week draws near, railway systems in Metro Manila are set to suspend operations to give way for maintenance activities. The MRT-3 announced it will have its scheduled maintenance and rehabilitation from March 30 to April 4. Meanwhile, the LRT 1 and 2 will both be closed to commuters from March 31st to April 4. The LRT management has also adjusted the schedule of the first and last trips on March 29 and March 30. The Philippine National Railways, or PNR, will also suspend its operation on April 1st except for one route. The railway will then suspend all train operations from April 2 to 3. Now, the following routes will resume operations on April 4. PHIVOLCS reports increasing unrest over the Taal volcano, which suggests a possible magmatic eruption. In an earlier interview here on One News, PHIVOLCS Director Renato Solidum Jr. acknowledged that there has been an uptick in the number of earthquakes linked to Taal. But he stated that should there be an eruption, areas in the vicinity of the volcano won't be greatly affected.
But the volume of magma that we're estimating near the surface is not large enough. We think that the current prohibition of the Taal volcano island as being restricted would be enough for now.
Solidum added that there is no reason to increase the alert level on Taal volcano as of the moment.
Well, it depends on how the volcano will manifest its activity. Right now, we're not seeing continuous ascent of magma. So once we see that, then we can raise the alert level, because once we raise the alert level, the probability of having a magmatic eruption increases.
Environment group World Wildlife Fund is urging Filipinos to take part in the annual Earth Hour tonight by switching off lights beginning 8:30 p.m. WWF Philippines Earth Hour Director Angela Ibay says Earth Hour 2021's theme is to encourage people to speak up for nature in various creative ways. International Director General Marco Lambertini explains that this is a crucial year for humanity amid the COVID-19 pandemic woes. Environment Secretary Roy Simato also calls on households and businesses to participate, noting that it could do so much in helping nature. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.